Hi, Neighborhood Health. With the upcoming vaccine mandate, we wanted to share with you some staff stories of how they went from being hesitant to get the vaccine to choosing to get it. So you will be hearing from our community health workers, Jania, Shahalini, and Jacquel. And you'll also be hearing from some of our providers to answer your common questions and concerns. We know this past year and a half of COVID has brought a lot of challenges and a lot of decisions to be made. So we just want to give you all the information you need to make your decision about getting vaccinated.
Hi, I'm Jamia.
I'm Jacquel.
And I'm Holly. And today we're going to be discussing our stories and what encouraged us to get the COVID vaccines. So who wants to start?
So I think I'll take the lead. Okay. So hello everyone, like I said at the beginning, my name is Jacquel. Let me tell y'all about my experience. I know, before I received the immunization, I heard about it, society, social media, even my parents. Mm-hmm. They just like, I don't get it. It's a chip in the vaccine. They're trying to control you, right? I heard that. So in my mind, I'm like, okay, you're my parents, so I'm gonna believe you, right? So I came to work, and as we were registering, the patients that was coming in, a few of them did ask, so, did you receive it, or what was your side effects? And in my mind, I'm just like, I feel bad, just not being able to educate them and give them like how I experienced it. Mm-hmm. So that was my encouragement right there, just to, just go up there, receive the vaccine, and you'll be all right. So I received it, and overall, I'm proud of it because I was able to, go around my grandparents and my, my other relatives and everything, so, and my friends too, so yeah.
Okay. What encouraged you to get the vaccine, Holly? What was your experience?
So, obviously, social media is very big. You see it, people use it every day. So, when you're seeing people have adverse reactions to the immunization, it scares you a little bit. It frightens you. You don't know. It's like, well, if that happened to them, what could happen to me? Mm-hmm. And then, on top of that, hearing people say, oh, well, as a woman, if you get it, it can make you infertile. Or, like Jacquel said, oh, no, they have chips in it. So, that, strayed me away from getting the vaccine. Mm-hmm. But, doing my own research about it, talking to Dr. Singleton, who's actually very nice. She's actually really down to earth, really easy to talk to. And then Patty, of course, it helped me feel more confident in getting my vaccine. And then, I have a grandmother who's really ill, who's very sickly, and then I also have other family members that I didn't get to see as often. So that was another reason. Because, us working the vaccine clinic, we had all of our elders coming in, and they were so excited to get it so they could be around their family. That was another push. So, what about you?
For me, I'm not afraid to say that I was deeply, deeply influenced by social media. I believe I had saw the video of the nurse who passed out.
Me too.
And she scared me. Yeah. And I'm like, oh no, I'm not doing it, and nobody can make me.
Yeah.
And then I was hearing, my family members saying how, well, usually some family members have said too, well, that's not for black people and things like that. And I'm just like, you know what, you're right. I'm not going. I'm not doing it.
Just agreeing with them.
They were agreeing with them. Yep, because I wanted to listen, and like Jacquel had mentioned earlier, those are my parents. I'm going
what they say goes.
Yeah. Even though I'm 34 years old, I'm still just, So I had it in my mind that I wasn't doing it, and I think what happened for me was seeing the older people come in, and I'm like, okay, if these people in their 80s and 90s can come in here and do this.
And they were so excited.
And we're very happy because, a lot of them were shut in from seeing their family and, like you mentioned earlier, new grandbabies and things like that, and I could not imagine. So I'm like, well, let me stop being soft. I'm being a little soft. So that's when I took the time to talk to Dr. Singleton. She was down here in the vaccine clinic with us a lot and encouraging us. And what I love most about that experience and what I kind of credit for me actually getting it was Dr. Singleton taking time out of her day to pull a chair. We sat in this corner actually right here. She pulled up a chair and was like, "What are you afraid of?" And I was kind of just like, oh, okay, because it was just, all I felt was just me and her in that moment. And she was so caring, so kind, so compassionate about it. And I said, well, I'm afraid of how it's going to affect my body.
Yeah.
Like, and I heard that, it will, different races, it'll affect you differently. And she's just like, no. She was like, she encouraged me to go visit the CDC website. And then she just kind of told me that it'll affect everyone differently. And then that's what she told me too, that normally with the symptoms and stuff, you probably will get symptoms for your second dose, but they'll last less than 24 hours. I'm like, okay, I've been sick for 24 hours.
Right, we've been sick
Less
longer than that.
Yeah, I was like, okay. And she was like, there's even no guarantee that you will get sick.
Yeah.
And I said, okay. So I have a question for you guys. What was it like when you actually got the vaccine? Like, what were some of your symptoms? What happened?
So for me, August of 2020, I did have COVID.
Yeah.
And let me tell you, that definitely took me out. It scared me a little bit, but as far as receiving immunization, I'd say about after maybe 2 hours or so, my arm started hurting and my glands started swelling up a little bit, but maybe after a day or two, like, it went away. And then after, like, even receiving my second one, like, I was fine. And I'm like, well, what are these people, scared of or talking about? Like, I mean, I was one of the people that was scared of needles, but man, my experience was great.
What about you, Holly?
So I've always been kind of scared of needles, which is weird because I have piercings and tattoos, and people are like, oh, if you can do that, you shouldn't be scared of a little immunization. But overall, like, I did fine. Like, obviously, I had the more normal symptoms. My arm hurt. I was a little tired, so I did get the fatigue part of it. But with the next day, like, I was fine. Like, I took a nap, woke up, my arm hurt still a little bit, but I was fine. And even with the second one, like, I did fine. Like, my arm hurt, but that was really it. I didn't get any, like, crazy symptoms or anything. How was your experience?
Yeah.
Ooh. So, I'm glad that mine actually went smooth. I believe we got our vaccines towards the end of the day. So we were almost out of here, and I'm kind of glad it was the end of the day because I probably would have been in here asleep somewhere and y'all wouldn't have found me. But I did get the fatigue part of it and the sore arm. Literally probably 30 minutes after my first dose, I called my sister. I'm like, I'm coming. Have a blanket out for me because I will cause an accident if I fell asleep behind this wheel. Like, it really just took me out. So I don't know if it was because I have sleep apnea that it hit me so hard or what, but yeah, it was the fatigue hit me hard and then the sore arm, and I literally slept for about an hour, and after that I was completely fine. Second dose, I went bowling the next day. I think we got ours on a Friday.
Yeah.
I went bowling.
Because our second one we got earlier in the day, right?
Yeah, we got it earlier in the morning and stuff, and I'm just like, oh man, I'm about to get sick, they're about to send me home and stuff, but nope, I was in here like.
I was a little nervous with the second one too because we had got so tired the first time, but the second one I was fine.
And John, I know you had mentioned too that you were discouraged from getting your second dose, and we kind of had to tell you, no, you
kind of had to talk you
complete your
into
series.
Yeah.
Yeah, I was discouraged because after I received my first one, I told my parents about it, and they was like, you stupid, you shouldn't have did that. Now your DNA gonna change, and I'm just like, okay.
That's the social media thing. Everybody said, oh, well, it's going to change your DNA. Or what was the other one? They were giving you the COVID. Did you guys hear that one too?
Yeah, and I think too, some of our providers will touch on that.
Yes.
About some of the myths.
The myths and misconceptions about the immunization. Things that aren't true.
And I believe you had mentioned to that your headache, you were like, you didn't like the way you were feeling.
Nah, I was.
You were like, I'm not getting that second one. I'm like, yes, you are. We're gonna complete this in the
No,
next.
actually, I heard it from one of the staff here that was saying that they didn't want to get it because of the headache. Yeah, I was like, oh, well, I didn't really experience that, but.
Yeah, but you know, like what Jania said when she spoke to Dr. Singleton, everybody's gonna react differently, especially if you have like underlying health conditions. It's not gonna affect everyone the same, you know?
Yeah.
So you do have to take your medical history into account for some of those too.
Yeah. Is that all?
I think
We
that's
covered
it, that's
everything?
it. All
All
right.
right.
Thank you.
Get your vaccines.
My name is Brianna Poole. I'm one of the nurse practitioners here at Neighborhood Health, and I'm just here to answer a few questions today on the COVID-19 vaccine. The first question that I had was whether the vaccine is safe when pregnant, and the short answer is definitely. So there are two main groups of OBGYNs. One is called ACOG, or the American College of Obstetricians and Gynecologists, and the other one is SMFM, which is the Society for Maternal and Fetal Medicine. They're like the MFM doctors. They see the high-risk pregnant patients. And both of them highly, highly recommend that all pregnant patients be vaccinated for COVID. I can see where you'd have concern about getting the COVID vaccine while pregnant, as there weren't pregnant women in the original studies. However, since that time, there have been several studies that have looked at tens of thousands of pregnant women and their babies, and it has been proven both safe and effective for mama and baby. As far as side effects from the vaccine, that's the same as you or I would get. It's some arm soreness, feeling like you worked out, having maybe a little bit of redness where you got the shot, and then feeling just a little bit run down for a few days, maybe a low-grade fever. You can take Tylenol for those, and you should feel better within a couple of days. As far as the side effects from COVID while pregnant, that has been shown to be much more serious. We've seen moms in the hospital, we've seen blood clots, and we've seen a lot of premature birth as well. And unfortunately, there have been stillbirths from COVID as well. So to protect yourself and to protect your baby, I definitely recommend that you get the COVID vaccine while pregnant. And the next question that I have was about being pregnant, getting the first dose of one of the mRNA vaccines, that's Pfizer and Moderna, and then getting the second after birth, and whether that would affect baby. So the great news is that of the 3 studies that I looked at, anywhere between 99 and 100% of babies born to a mom that got both doses of either Moderna or Pfizer in the 3rd trimester had antibodies in their cord blood on birth. So you're protecting yourself from getting COVID, but you're also protecting baby. Having gotten one vaccine and not the other, you will be fully protected because you got both of them. Baby will be protected. About 44% of babies had that antibody in the cord blood after just one dose in the 3rd trimester. So definitely better than not getting any. And even with getting both doses before delivery, we're not quite sure what level the antibody needs to be at and how long those will last. So even if you've gotten both doses of the vaccine while pregnant, still very important to practice good hand hygiene, social distancing, not letting everybody kiss on the babies, because besides COVID, there's RSV and a few other viruses going around. So definitely still take precautions, but great job on protecting your baby.
Hello everyone, I am Loretta Warren, family nurse practitioner from Neighborhood Health. I'm here to clarify some questions in regards to the COVID-19 vaccination. The first question is, how will I know if the vaccine will make me sick or not? So to answer your question, there are some side effects that you can get from getting the vaccine. I particularly had 2 of them, body aches and chills, which only last for a short period of time. And I would tell patients who also had similar symptoms from the vaccine that you can have those symptoms, but I think the benefit outweighs the risk of getting the actual virus and potentially getting sick from it, possibly intubated, and even the worst is death. So to have those side effects from the vaccine, I think trumps actually getting the actual virus. And so overall, the vaccine I feel is effective even with the mild side effects you would get from it. Okay, so the second question I was asked to answer is if you've already had the vaccine, patients or people are saying that you are protected for up to 3 months, so why should you feel the need to get the vaccination? CDC recommends or states that the antibodies are only present in your body up to 90 days or 3 months. So after that, you no longer have that protection. The vaccine actually is in your system much longer. Studies are still unaware or unsure how much longer. That's why we're having the booster shots now, and especially with the different variants. But it is recommended that you still get the vaccine because those antibodies do not last as long as they would last with the actual 2 series vaccine with the booster.
I am Dr. John Mormon. I'm a family physician at Neighborhood Health Clinic. I've been here for the last 6 months. Prior to that, I practiced in Fort Wayne for the last 40 years. So the question that has been asked to me is, why is the Pfizer COVID vaccine the only vaccine approved for children aged 5 through 17? Despite the fact that this vaccine is very similar to Moderna, it is the only one that has been studied for that age group. Pfizer has done the appropriate studies for this age group to obtain approval through the FDA and CDC. The other drug manufacturers have not done the studies yet, period. I anticipate they will down the road, though, however. I have been asked the question as to why people should get COVID-19 vaccination when people that have received the vaccination still get the illness, period. The reason to get the vaccination is that even if you get the illness, it's generally much, much less severe, and you're much less likely to be hospitalized and certainly die, period. Figures I've seen that you're 10 times less likely to become ill and hospitalized if you get the vaccination, period. So the COVID-19 vaccine is like many vaccines. They're not 100% effective, but they are very effective in preventing hospitalization and death, period. Certainly it's much more effective than the flu shot, which is only about 50% effective, period. I have some personal, situations where I've had family members get immunized or not immunized. I've had probably 6 or 8 people in my extended family on my wife's side come down with COVID-19 over the last year. 2 of them that were not immunized, one middle-aged and one elderly, both died from it about 6 to 7 months ago. And then I've had 2 other family members just in the last 2 weeks that are in their 80s that were immunized. They came down with COVID. They had mild symptoms of cough and congestion. They got COVID testing, and they were positive. But none of them ended up in the hospital. None of them actually had to go to the doctor. And obviously they were quarantined, and now they're on the road to get their 3rd COVID shot. But that's the difference, is to keep people out of the hospital and to keep people from dying. And the secondary benefit is felt even if you get exposed and you get COVID-19, there is some risk of spreading that to somebody else asymptomatically, but less likely than the person that has not been vaccinated. So it's well worth doing. Healthcare providers are certainly aware that many individuals, patients have concerns about the new vaccine for COVID-19, that it was rushed through because of government sponsorship, and how do we know it works, how do we know it's safe. It's been given to hundreds of millions of people, and probably the biggest thing to show that it works is they do studies in different parts of the countries, different countries in different states, where populations have received the vaccine and populations that have not. Even in the United States, they can compare individual states that have high vaccination rate versus low vaccination rate, and there's a significant difference in the risk of the population being hospitalized and dying. The same thing is true for multiple countries in Europe, where certain European countries have vaccination rates of 70-75% or greater, and other ones have it under 50%, and there is a major difference in the hospitalization and death from COVID. So the proof is kind of in those statistics.
My name is Dr. Lauren Stoffel. I'm one of the family practice physicians here at Neighborhood Health Clinic. One question that I've been asked before is, can babies get COVID? Absolutely, babies can get COVID. When COVID first came out, it was thought to be a disease that only affected the elderly, but later on, as more and more people got it, it has been found to affect people of all age groups. Specifically at Neighborhood Health, I've seen it in children as young as 4 months old. There's also long-term complications called MIS-C, which stands for multi-system inflammatory syndrome in children, and this can affect all different organ systems in their body. It's rare, but it is a potential complication in children who get COVID. Another question I've been asked is if breastfeeding will be affected at all by vaccination. It'll actually be affected in a positive way. The vaccine has been shown to pass through breast milk and give some benefit of immunity to the breastfeeding infant. Personally, when I was breastfeeding, I did get the vaccine. It was a very big hesitation of mine because it was so early on in the days of vaccination. There wasn't a lot of research done at that time. However, I'm very thankful that I did and thankful that I was able to protect my baby through getting vaccinated.
Well, guys, I hope we helped answer your questions that you may have about the vaccine. If you guys have any further questions or concerns, please follow up with your medical providers, and Patty and Dr. Singleton are great resources here at Neighborhood Health.
And if you're looking to receive the vaccine, make sure y'all get with us. We'll register you for that vaccine.
Thanks, guys. Bye.